Susan de Abate, welcome to our show.
Thank you.
We're
Nice
here
to
at
be
the
here.
conference for the American Association of Diabetes Educators, and we're just so pleased you dropped by our booth.
Thank you very much.
Susan's been telling me she works in long-term care, and I naturally thought this is where people just go to live out their days. But tell us what really goes on.
Well, it's actually a combination of long-term care and rehab care. So we actually get a lot of people that are coming in to return back home, actually, many times after a knee surgery, a hip surgery, strokes, those kinds of things. So they come in usually for about 20, 21 days. We have access to them to provide education, of course. Of course, they're also getting some rehab during that time, but it gives us a great opportunity to provide a lot of education.
That sounds wonderful. I know with my mom, she'd go into the hospital and then she'd go into a care facility, but usually they weren't very good. Usually they had no idea about how to take care of diabetes.
Well, as I'm a EVA chapter president, which is our one of the chapters of AADE, and we actually did an environmental survey in our area, and we actually identified that in general, the nursing homes and long-term care facilities didn't see that they had a need for diabetes education. And we, on the other hand, as educators, saw the need in practice. When I was working in home health, the need was very apparent.
Now, home health is where you go visit people in their homes?
In their home. And we would get people from nursing homes who had not received any education.
Oh, so that's after they're the hospital, then the nursing home, then they're back at home.
They're back at home.
And then they would send you out to, and you'd realize, oh my gosh, they don't know a thing about diabetes.
In nursing homes when they've been there for 20, 21 days. And so my next step in my career was to get to that point, because I had already worked with home health, got their program up and running, and I really wanted to go ahead and move into the next arena to try to improve the standard of care of diabetes in long-term care. So that's where we're at.
I'm going to ask Susan to come over a little more close here. Now, what are the biggest problems you find in the long-term care facilities?
We're getting a lot of brand new diabetics, unfortunately or fortunately.
You mean just diagnosed?
Just diagnosed in long-term care. And truly, up until this point, until I arrived, really, the staff had not really received a lot of diabetes education. So it's kind of twofold. I'm doing a lot of the education of diabetes of the staff so that they can provide better care for the residents that are under their care, as well as the population of staff that I have, and our location is one of the highest areas of diabetes in general. So I also have a staff that are pretty much anywhere from 80 to 90% diabetic, or have someone in the family who are diabetic. So I have on the staff.
So you're starting like with the staff their own diabetes.
That's right. So we're doing both. We're doing both. And we're just in the early phases, because since long-term care for me was a brand new arena, I had to learn long-term care a little bit. Got my feet wet, and now ready to proceed with the diabetes emphasis. And it was one of the things when I came on board, that was one of the underlying things that I made clear with the administrator, and he was very receptive and said, whatever you want to do is fine. And so I have free reign pretty much to do some of that.
Well, Susan, as someone who's had parents in these facilities, I really admire you. It's probably not the most it's not the most glamorous of the diabetes
No, it really
fields.
isn't. And I think in general, even from a nursing perspective, I've been a nurse for almost 30 years now. I have found such, unfortunately, a bias in terms of the staff that work in long-term care. It's kind of the idea, acute care almost looks at us as if we don't know what we're doing, or we're the only nurses that work there who can get a job in a regular place. And unfortunately, it's so far from the truth, because unlike acute care, we don't have the ability to call a doctor and have them come and see us in 2 minutes. You know, there's nobody downstairs. We're it. So
they come by maybe once a week.
If we're lucky. If we're lucky. Many physicians, actually, they're required to come every 30 days, 60 days. So we have to be the eyes and ears for the physician. And it's up to the nurses to be very much on their game, to be able to identify issues or problems that are occurring and give the doctors a heads up. and be able to recognize when those residents need to go to the hospital and those kinds of things. So we're an independent group of nurses and very high on our game in terms of critical care thinking and all. So,
you know, I've done talks. I go out and speak to retirement homes, and the question and answer phase, people ask questions about why their blood sugar is up, and I found a lot of people on some of the oldest therapies, the oldest insulins, and it made me sad. This one group, we all realized that they weren't getting top-notch care, although there were plenty of money. It just seems like the doctor has so little time. Why put someone on a newer insulin or a new? Or do you find that you get with patients they're taking a shot of NPH once a day or something?
We're not really finding that as much. Actually, we have many patients coming in on Atlantis, on the Novalogs, the Humalogs. So the other part of it was the staff wasn't aware of the new insulins yet.
I see.
So it was a matter of educating them because the patients were coming in with it. They were even coming in to be trained for the first time on a pen, and none of the staff had ever seen the pen. So it was really a nice marriage, if you would, for me coming into long-term care, because now they just call Susan, and then Susan goes over and explains the process to them, and in addition, and we've of course done lots of education of our staff to bring up their standard of care in diabetes. So it's been a win-win situation for both sides.
Well, Susan, you're kind of my hero. I've got family members going into long-term care, and it's just so nice to know that you're out there making it better for them.
Thank you very much.
And thanks for coming on the show.